Pulmonary function tests, or known as PFTs, are performed to determine if an individual is experiencing problems with their lungs. It's to measure airflow, the volume of your lungs, how well your lungs exchange gas, you respond to bronchodilators, medications that open the airways, and also how your respiratory muscles function. We ask that you wear loose, comfortable clothing, no heavy meals prior to the test, avoid your puffers if possible, and no smoking day of the test. You will sit in a big clear box, wear nose clips, and communicate to the computer with a mouthpiece for all tests. A complete test can take up to 45 minutes to 1 hour. The patient may feel tired or lightheaded following the test, but can be expected due to all the breathing tests that are completed in a session. Lung plasmography measures the flow through your airways, which is the one done in the box with the door shut, as well as how much air is in your lungs after you take a deep breath and how much air is left in your lungs after you breathe out as much as you can. This is the only test, again, that the door on the box will be closed, but it only takes 3 to 5 minutes to perform, and at any point you're feeling uncomfortable, we can certainly change the test for you. Spirometry measures how much air you can breathe out from your lungs and how quickly you can do it. It is the gold standard for accurate and reliable lung function tests. The lung diffusion test measures how well oxygen moves from your lungs into your blood. All of these tests are non-invasive, but they are effort dependent, and the patient must have the ability to follow direction. The Methacholine challenge test is a test that measures changes in your lungs function after inhaling a drug called methacholine. Methacholine can be an irritant when introduced into your airways. This drug may induce narrowing of the airways in susceptible individuals. It is a test to diagnose asthma and/or determine the effectiveness of the medications the patient is taking to manage their asthma. For each test, you'll wear nose clips and have a mouthpiece. There are various doses of methacholine that can possibly be inhaled. The patient breathes in the methacholine for 2 minutes, followed by a fast, hard blow into the mouthpiece, and this will occur twice after each dose. The test will continue once we see that patient reacts or that all the methacholine doses have been done. At that point, we give the patient puffers to open up their airways, and then we wait 10 minutes, and then we will repeat their lung function again to make sure that they're back up to baseline before they leave the lab. Pulmonary function tests are a very important diagnostic tool for your physician. This test is a good test for anybody who's having any type of breathing difficulties, who have any type of environmental exposures, a smoking history. Again, this baseline test, or again, to help diagnose, is something that everyone who has this condition should get. So if you feel that you may have any type of breathing difficulties, or like I said, a smoking history, or any other factors, get your breathing tests done and we can possibly see what's going on.